What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, March 28th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to be informed with what's going on with each and every one of these viruses. That's what I do here on my channel each and every day. I give you the latest news. I give you the latest data. Any studies that come out, COVID or other viruses as well, I update you on that here each and every day that I possibly can. If you want to stay informed, subscribe down below. If you like this video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Alrighty, we do have a few news stories today. It's possible we missed some news stories. Today was my turn to do my taxes, pay a visit to Uncle Sam. And, well, as promised, I said I would have an AirNet reading, and my AirNet readings at my tax appointment were in the upper 800s to low 900s is the readings I was getting. So that pretty much tells me what the CO2 level was in the place where I was getting taxes done. So, not terrible. Could be better. Could be a lot worse because there were some other people having their taxes done there as well. It was an H&R Block place. So, yep, there's your AirNet reading for my tax appointment today. And if we do miss any news stories today, I'll make sure we get to them tomorrow. I can tell you right now, it's looking like the Saturday edition of this update is going to be a busy one. All right, moving on. We're just only going to do a few things today because today is one of those long COVID days. The headache's there. Fatigue is there. Yeah, it's not a great day. All right, first off, measles. There is an important update that the Texas Department of State Health Services is reporting an outbreak of measles in South Plains and Panhandle regions. And get this, at this time, Texas now has 400 cases of measles identified. Yes, the number of cases continues to go up. Gaines County, Texas is leading the way with 270 cases, and there are many other counties in Texas that are reporting cases at this time. This outbreak continues to grow. Ages 0 to 4, 131 cases. Ages 5 through 17, 164 cases. 18 plus, 80 cases. And pending, in other words, we don't know the ages yet, 25. And when it comes to vaccinated or not vaccinated, unvaccinated or unknown, 398. 1 dose of the vaccine, 0. And believe it or not, 2 people have been fully vaccinated. So that is interesting to see. More on measles numbers in a minute when we go to the CDC, but we have to report on some other states that are having problems. Shelby County, Tennessee, is reporting its first case of measles. That's not good. And unfortunately, in my metropolitan region of southeast Pennsylvania, Philadelphia area, Bucks County, which is the county just north of Philadelphia, is reporting of a possible measles exposure at a Starbucks. Yes, someone who was positive with measles did visit a Starbucks up in Newtown, Bucks County. Now, some of you are probably wondering right now, or those who know are probably saying, hey, I'm a delivery driver. Did I go to that Starbucks? No, I did not go to that Starbucks. And I can't say I've ever been to that Starbucks. I don't think I've done a delivery there. If I did, it would be many years ago. But generally, I don't make it up that way. Rare cases, I get close to there. But it's been a while since I've had any delivery doings in that area. But this is just bringing the fact that you need to be aware of what is going on at any given time. Think about this. Maybe you're going out there to get that real ID. That is a big thing. I know some people who had to get it done. I know a family member who had to get it done. There's a lot of people that need to get that done. The point I'm trying to bring your attention to is think of crowded places right now as a big uncertainty. Not only do we have COVID and these other viruses, but we also have measles at any given time, any place you go, such as a Starbucks, which, sometimes Starbucks can get crowded at peak times of the day, first thing in the morning, maybe a mid-afternoon pick-me-up, whatever the case may be. Be aware of what's around you. You never know if you're going to come in contact with someone who currently has measles. already. As of March 27th, 2025, in the United States, a total of 483 confirmed cases of measles were reported by 20 jurisdictions. And yes, we'll read the states: Alaska, California, Florida, Georgia, Kansas, Kentucky, Maryland, Michigan, Minnesota, New Jersey, New Mexico, New York City, New York State, Ohio, Pennsylvania, Rhode Island, Tennessee, Texas, Vermont, and Washington. All are reporting measles cases. I think we're going to see more pop up. I'm surprised we're not seeing more cases out of Florida. There's a few states I'm surprised that are not reporting anything yet, but like I said, I think we're going to see more states pop up for this. Under 5 years old, 157 cases. 5 through 19 years old, 204. 20 plus years old, 111. Age unknown, there's 11 cases for that. 97% of these cases are unvaccinated or unknown at this time. And 3% are either vaccinated or partially vaccinated. 1 is 1 dose, and 2% is 2 doses of vaccine at this time. Then we get up to Canada. Sorry if this looks like the measles show today, but there's a lot of measles news. Parents, educators on alert as Ontario measles outbreak rises to 572 cases. We are continuing to watch this one grow. But let me explain something to you. They have 572 cases. I just said the United States has 483. I got a feeling we're missing cases here in the United States. Now, can I confirm or actually show proof of that? No, I can't, but do I think Ontario is going to constantly remain ahead of the U.S.? No, I think at some point the United States may pass the number that's being seen in Canada, but who knows? It is very concerning as to what is going on right now with measles. This is really bad. All right, moving on to this. Just going to read a headline here. Tests show emotional behavior problems in adolescents with long COVID. And take a look at this kid. Look at that. He does not look very happy. He looks very sad, and he looks like he's just miserable. Yeah, a lot of us people, and mind you, I'm not a child, but a lot of people that are dealing with long COVID, it's not a pleasant experience. It's miserable. And I can only imagine how hard it is for a child that is trying to go to school, get his education, do well in school, and is dealing with long COVID. That must be so challenging compared to the other students who are not dealing with long COVID. Yeah, I mean, we need to really do something to contain what is going on with COVID because it is such a horrible virus. All right, look at this from New York City. Yet again, thumbs up, double thumbs up for New York City. Confused about when you should wear a mask? Here's what to know about masking and COVID-19 transmission. I mean, they have several times now posted about masking in New York City. Meanwhile, some neighboring areas such as Long Island are saying, like, oh, we don't want anything to do with masks. It's really crazy. Masking protects you and others by reducing the amount of droplets that enter the air when someone coughs, sneezes, talks, sings, or breathes. Wear a mask in crowded indoor public settings such as on public transit, at large events, and when shopping in crowded stores, especially when COVID-19 levels increase. If you are sick and unable to separate from others, and for 5 days after you leave home, once you start feeling better, as you should still may be contagious. So in other words, continue masking. For 10 days after being exposed to COVID, or someone who has COVID, keep masking. If you are at high risk for severe COVID-19 or are around others who are, mask. Wear a well-fitting mask such as a K95, KF94, or a N95. Here you go, N95, for the best protection from COVID-19. All right, double thumbs up once again for New York City for sharing us that information. We do have wastewater scans, weekly virus update. I think we're going to save that for either tomorrow or more likely we're going to show that probably on the wastewater update on Sunday. I'm not showing that today. We do have new data from the CDC, but let's get to this. Here is bird migration, and I really like that we do this now, that I show you this. If you like seeing this, let me know down below. Take a look at this. Bird migration. A little bit more east today. Look at this. Heavy migration over Tennessee, Kentucky, Illinois, back up into the northern plains. Yes, birds are migrating north. Spring is here. The warmer weather is coming. And, well, birds migration. And someone's probably saying, why am I showing this? because with migrating to the north, with birds migrating to the north, comes the risk of the spread of bird flu, causing more new outbreaks. So we have to be mindful of that. And today, if you're in any of these areas from the Gulf Coast, Florida, straight on up into Tennessee, Alabama, Kentucky, Georgia, Mississippi, Illinois, Missouri, Iowa, Minnesota, Wisconsin, on and on I could go. Any of these areas, please be extra mindful today. Stay away from the birds. Hey, yesterday I saw a goose, I saw geese in a parking lot that was nowhere near water, nowhere near woods. It was just wandering around. I was trying to back up. It wouldn't move. I was like, will you please move? And eventually it did. I didn't go near it, but yeah, they're out there. They're migrating at this time. Taking a look at what's going on with air qualities. And this weekend, there could definitely be some air quality problems. It's going to get rather warm in the east, well above average temperatures, and those areas are going to see air quality problems. Take a look at this. Wow, Alabama, Georgia, North Carolina, Tennessee. You also have wildfire threats in there. There have already been some wildfires. I didn't get a chance to look to see if that's continuing today, but add that to the mix. And if the wind is going from south to north, some of that smoke could blow to the north. When I was outside earlier, it did smell a little bit smoky in the air, although it looked like I saw a fire nearby. So I saw smoke coming up from a building. Take a look across the Great Lakes. Some orange there. Also a few problems on the west coast as well. Taking a look at what is going on with tree pollen, that's starting to spread north. I noticed some trees that were blooming yesterday. I think they were cherry blossom trees. At least I think that's what it was. So yeah, it's getting to be that time. We see reds in the Carolinas, Georgia, even portions of Alabama, Oklahoma, New Mexico, Texas, seeing some reds pop up where, yeah, tree pollen's very high. I took my allergy medicine today. See here? Yep, I took my Allegra. And if you take allergy medicine, you should start doing that. Or talk to your doctor. Maybe you don't take allergy medicine, but your allergies are bad. Maybe they got worse if you had a case of COVID. Make sure you talk to your doctor and see what he recommends you take. I take Allegra. But by all means, I am not promoting Allegra whatsoever. All right, moving on to this. Pinellas County, Florida. We do have a few sick person calls today. 1, 2, 3, 4 of them I see here. See breathing problems a couple times and a few other things going on. Taking a look, or trying to take a look, at what the number was for Philadelphia yesterday. We'll have to see here. And they do have it here. Thursday, March 27th. 717 EMS incidents were reported in Philadelphia. As always, I got to tweet that out. That was not there this morning when I was looking. I'm finding a news story that I forgot to mention earlier that did not make it into the correct spot. All right, I'll just read this to you. 20 deaths a day. Australia's ongoing COVID death toll. So, yeah, they're still averaging 20 deaths a day in Australia. Yeah, this is not good. 20 Australians are dying every day because of COVID-19. 5 years after the pandemic, that changed the world. And mind you, I must say, most health agencies, health authorities, the WHO, all these different places around the world are still saying COVID is no longer a pandemic. So, yeah, I mean, that's a lot of deaths. I mean, think of it this way. Australia doing 20 deaths a day times 365. Well, they would still be averaging 7,300 deaths a year. Hello? I mean, that's just from COVID. That's not including flu, RSV, strokes, heart attack, heart disease, diabetes, cancer, on and on and on and on I could go. Come on. Those are deaths that were not occurring before 2020. They weren't. Those deaths those are 7,300 more average deaths a year in Australia than they were having beforehand. And someone will say, well, that person would have died before. You don't know that. I mean, medical achievements, the advances in medical procedures and different things nowadays actually save some people from dying from some of these diseases. But COVID's just the thing that makes it worse sometimes. And you know what? They may have been saved if they never had COVID. You just don't know that. Montgomery County, Pennsylvania, currently is seeing 13 calls. One of them is cardiac arrest. Moving on now to this. Taking a look here, we can see Chester County, Pennsylvania does have some calls ongoing at this time. Looking at the hospital situation in Pennsylvania, Yeah, a few hospitals having problems. Not as bad in Lehigh Valley today. 3 hospitals in southeast Pennsylvania dealing with problems at this time. In New Jersey, I hope we have good news here. We do have Inspira Medical Center with a problem. RWJBH University Hospital has a problem. And that's it for New Jersey today. In New York State, 1,405 people have tested positive. You can see here the trend line. It is starting, the average trend line. It is starting to trend down a little bit. We can only hope that will continue. Hospitalizations in New York State today. First off, New York City, 392 people in the hospital and 42 people in the ICU. Yeah, that's up slightly once again. And I'm not going to say the words, I hope that's peaking, because honestly, I don't know at this point. We've had false hope before from New York City. New York State itself, 748 people in the hospital, 81 people in the ICU. Los Angeles today, we do note that the COVID positivity rate has gone up ever so slightly. It was 2.19. Now it is up to 3.21%. Influenza has dropped to 8%, and RSV is 3.77% positivity rate. So that is something that we're obviously going to have to keep an eye on. More on this probably over the weekend. We'll probably review this all once again over the weekend. All right, drum roll, please. Something that's going on in the COVID variant front from the United States, and that is COVID variant soup. Yeah, you've heard me mention that before. A lot of other people have used that phrase before. Well, we're not really having as much COVID variant soup. Why? Well, the LP.8.1 variant is now up to 55% of the cases in the United States. And you can see COVID variant soup. There's a lot of other variants there, but they're down to just 1%, 2%, 3%, or 4%. So 55% is now where LP.8.1 stands. XEC is down to 21%. That's continuing to decrease. LP.8.1 is continuing to go up at this time. And I don't see anything else here sticking out that is saying to me that, this could potentially be something down the line that overtakes LP.8.1. I'm hearing some rumblings about some other variants around the world. I'm not going to really mention them today. I think I may have mentioned them once or twice in the past, but until I learn more and become more educated on them, I'm not going to give them a mention for today. Who knows? Tomorrow's another day. I may learn something between now and tomorrow. All right, taking a look at some more CDC data. Good news. Wastewater in all regions of the United States looks to be going down today. I don't see anything here. No. Are you seeing anything? I'm not. I don't see anything that suggests that it's going up for COVID at this time. Influenza A in wastewater. Look at that. It's continuing to drop at this time, which is very good news. RSV in wastewater. And mind you, we're going to look at this all again over the weekend. Sunday is our wastewater Sunday. So anything and everything I can find wastewater related, that's what I do on Sunday. Low levels of RSV at this time. But take a look here. It did go up a little bit. The national RSV wastewater level, that did go up ever so slightly. We'll just keep an eye on it. Nothing alarming. Something to keep an eye on. Taking a look at what's going on with the hospital capacity data. And you know what? Let me refresh this. I don't know if I did or not. That's saying March 22nd. Okay. And we can see here when it comes to the ICU data, 72.1% of ICU beds being used. And we take a look at inpatient bed usage overall. That is 74.5%. So that did come down once again. We'll look at some individual states maybe in a few days or sometime next week. Let's pause for a second. Let's take our hydration break because I need it pretty bad. You need to take a hydration break as well. Water to drink of choice today. Pretty good thing you can have to keep yourself hydrated. Alrighty, taking a look at what is going on with percentage of emergency department visits diagnosed with COVID-19. And take a look at this. It is continuing to drop at this time. Not dropping as fast as it was a couple days ago. There's a little notch upward in these blue lines here, but overall, it is still dropping. And you know what? It's good to see it dropping, so that is a good thing. Taking a look at what is going on with the influenza-like illness map, and take a look at this. It's getting better. Let's reverse this. You can see here how bad we were, and it really was a bad winter. We're in spring now, and things are getting better like they should. Look at that. Less and less high areas, and nowhere in the United States is reporting very high this week. That is some good news. Maine and New York State are still coming up at the highest shade of high. And then we still have Michigan, which is coming up in the medium range of high, as is Oregon. And then we do have some other states that are still coming up high. We have Louisiana, we have New Hampshire, and we also have New York City, which is not a state, but a big city, the Big Apple. That is still coming high. Then we have several places that are moderate, low, and yes, we do have places now that are even minimal. So this is some fantastic news to see this map continue to get better. Then we end today with epidemic trends. And COVID, it's likely growing now in Washington. Everywhere else is likely declining or is declining. And when it comes to epidemic trends for influenza, it is declining, likely declining, not estimated, or not changing. Nowhere is growing at this time. And there are some places for COVID where it is not changing or just not estimated at this time. Alrighty, folks, that does it for the Friday edition of the Virus Update. If you liked this update, give it a thumbs up. If you're new here and you enjoy seeing this and want to see more of this, subscribe down below. Hit that notification bell to be notified of my latest updates. Share this video with anyone you know, and leave your comments down below. I will see everyone again tomorrow for what will likely be a very busy Saturday edition of the Virus Update. Until I see you again tomorrow, or maybe you won't see me this weekend, maybe you'll be too busy to watch my videos. Have a fantastic Friday evening and a fantastic weekend. Thanks for watching. Stay safe, everyone. Take care. Bye-bye.